Look, over the weekend, we saw some disturbing news come out of California where anti-vaccination protesters had actually shut down mass vaccination efforts at Dodger Stadium. I'm wondering what you're seeing at the hospital and how your staff is combating vaccine doubts and building confidence that the shots are in fact safe.
Yeah, that's really good points, Tim. I did see that in Los Angeles, and that was very disturbing, especially in my universe. I'm surrounded by people that are saying, how can I get this vaccine? My family member has cancer. My mother's 80 years old. And to see that was heartbreaking to me. So, one of the things that we're doing at Johns Hopkins is we're doing a lot of transparency. We're doing a lot of community outreach. We're actually having a seminar next Tuesday that is going to be entirely in Spanish to reach our Latinx population and say, look, these are the facts about the vaccine.
What are you focusing on in terms of educational message? Where is the hesitancy? What are the questions? What are the concerns that different groups have? And look, we should note, obviously, these groups are not monoliths. The concerns are, I would imagine, ranging.
Yeah, there's a wide range of concerns. You know what's interesting, Tim, is that there's a lot of discussion about adverse events, or I don't know enough about this vaccine. What's the science behind it? I read both the AstraZeneca and the Johnson and Johnson studies last night, and it's fascinating to me. There's really good science there. I think we really need to get a message out that says, this work was done at warp speed, but still really solid. You may have two different outcomes, and there's a lot of reasons for that. But to be able to get in front of a group and say, look, 17,000 people were tested, or in one group, there was 342. So this isn't a small population, right? And how this has been an international work. So this isn't just the United States. This is in Africa. This is over in the United Kingdom. Again, some of that good science message has to get out to people. The other thing that I think is very interesting in both studies is that the adverse events were very similar. That's sort of, I had a pain in my arm or I had a fever for this day. And I found that fascinating because, again, I've had people, focus on, I'm not going to get the vaccine because I heard that my friend had a fever for a few days. Getting a consistent, solid, factual message to groups in a way that they can understand, right? It's difficult. You and I laughed a few weeks ago about I'm not a statistician, right? These studies are sort of challenging to get through. For me, who has some experience in this, it's even more challenging for somebody who doesn't. So I think we at Hopkins and at any of our academic medical centers have to do a good job of translating this information to the general public. And again, I think journalists have a great role in this because people get information from a lot of different places. I
Yeah,
wish people would just come to Hopkins or go to Bloomberg, right? It's not
right.
going to happen.
And look,
So
it's a lot
we have to do
easier.
our work. Yep.
I think Nisa, it's a lot easier to watch a YouTube video that probably has
Sure.
misinformation than it is to comb through studies from Pfizer, Moderna, BioNTech, and the like. I do want to ask about those studies that you saw from AstraZeneca and, of course, from Johnson & Johnson as well. Some new developments. You heard me talk about this at the beginning of the segment, just the massive timeline that it would take to reach herd
Gosh.
immunity here in the United States. I'm wondering, based on the data that you saw yesterday when you were combing through these reports, how do you think that could change the equation when it comes to vaccinating the United States and other parts of the world?
Well, I think there's a couple pieces to this. I think what all of us want is a single dose vaccine that we don't have to come back for, right? That has 99% efficacy. And I don't know that that's a reality right now. It was really interesting to read some of the studies that talked about let's get as many of the people as we can vaccinated with this first dose to give us some level of protection against this illness. And then we'll look at, getting the second dose out and how do we roll that out. I'm also really concerned about the term herd immunity, Tim, because people begin to look at herd immunity as somebody else will get that vaccine. That's how I'll get my immunity. And that's, unless we all really look seriously at this, we are not going to have the protection that we need to fight this pandemic.
Yeah, that's the big question is about the messaging, right? And how we think about the term herd immunity and what it means to actually reach that. Nisa, what's the latest that you're seeing from inside the hospital? I always like to get updates from you about what you're hearing from your nursing staff and what the conditions are like, because we are seeing in many parts of the country cases and hospitalizations actually go in the right direction.
It's interesting. We're seeing that too. We're in this sort of steady state. You know, our flip number in Maryland is 8,000 cases. And so the other day we were at 6,053, and we celebrated that as a unit. We are seeing we're seeing the impact of things like a field hospital that's able to deliver monoclonal antibodies so that a patient doesn't have to get admitted. We're seeing the impact of, that first dose of vaccination. And now most of our staff has had their second dose. Please don't stop masking because you've had your vaccine. That's another message I really want to get out there, because both studies were clear that we don't know about how they protect against transmission. They will protect the person who receives the vaccine, but it's not clear about how that will protect someone from transmitting the virus.
I think this is, Nisa, going to be a big issue as the weather gets warmer and people start to spend more time with one another as more and more people are vaccinated, that we're going to see a lot of people move away from mask use around this. Nisa Ernst, Johns Hopkins Hospital nurse manager. Nisa, thanks as always for your time. We should note that the Johns Hopkins Bloomberg School of Public Health is supported by Michael R. Bloomberg, founder of Bloomberg LP and Bloomberg Philanthropies.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quicktake now for insight in an instant.